Hey, future doctors! Welcome back to our USMLE Step 1 Prep series. Today we're exploring a case of a 65-year-old woman with right-sided weakness and aphasia. Let's dive in. A 65-year-old woman with a history of rheumatic mitral valve disease is brought to the emergency department 30 minutes after the sudden onset of right-sided weakness and inability to speak. Neurologic examination shows weakness of the right lower side of the face and difficulty swallowing. Muscle strength is 3/5 on the right side. She can understand what is said to her, but she cannot repeat words or answer questions. An electrocardiogram, or ECG, shows atrial fibrillation. The most likely cause of the neurologic findings in this patient is occlusion of which of the following labeled arteries in the photograph of a normal brain? Let's break down the key points in this patient's case. First, we have the sudden onset of right-sided weakness and aphasia. Second, there's a history of rheumatic mitral valve disease and atrial fibrillation. Third, the neurologic findings include weakness of the right lower face, difficulty swallowing, muscle strength 3/5 on the right side, and the ability to understand speech but not repeat words or answer questions. Given the patient's presentation, we're likely dealing with a stroke. Let's evaluate each option by identifying which artery's occlusion would result in these findings. Option A. This artery supplies areas that wouldn't account for the combination of motor and speech deficits seen here. Option B. This artery supplies the regions of the brain that control motor functions and speech. Occlusion here is likely to cause the described symptoms, including right-sided weakness and aphasia. Option C. Occlusion of this artery could cause visual field deficits, but not the specific motor and speech symptoms. Option D. This artery supplies the occipital lobe and part of the temporal lobe, typically causing visual problems rather than the symptoms described. Option E. Occlusion here might result in cerebellar symptoms like coordination issues, which don't match this patient's presentation. Therefore, the most likely cause of the neurologic findings in this patient is occlusion of the middle cerebral artery, or MCA, which is option B. And that's how you tackle a USMLE Step 1 question on cerebrovascular accidents. Always consider the anatomy and the clinical presentation. If you found this video helpful, please like, subscribe, and hit the notification bell for more exam-crushing content. See you next time.